Hello, I'm Dr. Michael Jarman, a leading expert in pediatric foot and ankle care. Toe walking in children can be concerning to us parents for a few reasons. As a parent, we worry there's some other underlying medical condition and we want our children to have normal development physically and mentally. It literally hurts us to see them struggle. Toe walking can lead to other complications if left unchecked, such as other foot deformities, walking abnormalities, tripping, and fatigue. Toe walking limits your child's ability to be active, which can lead to frustration. The great news is this condition is 100% treatable and can be corrected in those children who have not responded to conservative care or age-wise require surgical correction. Now, when choosing a surgeon to correct your child's condition, it can be difficult to know who to trust or who has the best experience to ensure the best optimal outcome for your child. Here in my clinic, I see toe walkers every day, and I routinely perform toe walking surgery every Wednesday. I've been doing this for the past 10 years. Because of my reputation and my experience, we have patients that seek our care not just here in the state of Arizona, but from all over the United States. Because of this, we've created a pathway for out-of-state patients to have this life-changing procedure for their child. On our website, pediatricfootandankle.com, you'll find detailed information on this process, and we welcome you to call the office and ask questions. The most common question asked is, does my insurance cover this procedure? Yes, of course it does. However, some state plans may not offer out-of-state benefits. Please check with your insurance carrier or call our office. We also offer self-pay rates for families who are interested in this treatment option. A child's journey begins with a telehealth appointment with me to discuss your child's specific situation and to qualify them for surgical intervention. Our office surgical scheduler would then reach out to schedule a date for surgery and be the point of contact. The day before surgery, we would have an office visit here to complete a thorough workup and again confirm your child is a candidate and the correct procedure is to be performed. Parents and patients are able to fly or drive in the day before surgery and possibly even head home the same day of surgery. The day of surgery, you would need to be at the surgical center an hour before, and typically you're able to leave an hour after surgery. We do apply a cast to your child's leg that keeps them from bumping into the walls and to protect the surgical site. There'd be a mandatory 2-week follow-up here in the office to remove the cast, check the surgical site, and apply a new cast. We make a special modification to this cast so that you, the parent, can remove it yourself at home. At week 4 after surgery, your child would then transition out of this cast and into a walking boot for 2 weeks. Around week 7, an office staff member would call to discuss proper expectations as your child is transitioning out of this walking boot and into regular shoes. Because surgery is only one leg at a time, the surgery for the next leg is typically performed 2.5 months from the initial surgery. Parents and patients are able to fly in for this surgery the same day, and no office visit is needed. The same procedure as the first, with the mandatory 2-week office visit, a cast is placed for 4 weeks, and a walking boot for 2. We strongly recommend physical therapy for these children, and that would start approximately 6 weeks after surgery. All right, we are now 6 months out from the initial surgery, and we schedule a telehealth for our final follow-up to confirm your child's progress. It is at this point that these children typically graduate. My best advice for interested parents is to have an in-depth conversation with our office or myself to understand the complete steps, the logistics, and cost based on your specific case. We want parents to have a clear clarification of the process and to have all their questions answered. I hope this information is helpful for understanding that there is a pathway to correct your child's toe walking. I'm Dr. Michael Jarman. Thanks for watching.